you are celebrating or mourning tonight's election results, Allison Wine Promo has something for you. Allison Wine Promo, it is where you go to join my wine club. You get 6 bottles of amazing, extremely limited wines. They come from very remote parts of the world, sometimes between 6,000 and 9,000 feet. Family vineyards that have been in operation for sometimes over 200 years, still using the handmade winemaking techniques. Natural fermentation, no dyes, no fillers, and just a really great product. A lot of these wines are made from grapes that are picked and grown in places where there are very few pesticides in the area. And like I said, some of them from extremely high altitudes, like in Argentina. So go to the AllisonWinePromo.com wine club. You get 6 bottles every 3 months. And you'll always have a present. You're not a wine drinker, then bring it to an awkward post-election cocktail party. Bring it to work. You might need it there. I don't know what your boss says about that. But anyway, AllisonWinePromo.com. I have Dr. Griffin Cole here to talk about root canals on election day, because I don't know about you, but there is nothing more fun than talking American politics except for getting a root canal. So that's why we're going to talk about that today on election day. Dr. Cole, this is the American Association of Endodontists. They say they specialize in saving teeth. All right. They say, what is a root canal? And under here, they say it's a dental procedure to remove inflamed or infected pulp on the inside of the tooth, which is then carefully cleaned and disinfected, then filled and sealed. Root canal treatment is designed to eliminate bacteria from the infected root canal, prevent reinfection of the tooth, and save the natural tooth. And then they call it a quick, comfortable procedure that can relieve your pain and save your natural tooth. So I want to start there. I mean, this is probably the conventional message that a lot of people get when they go to their dentist. So let's put yourself in the position of the average conventional dentist. Okay, I'm coming to you. You're the average conventional dentist, and you tell me why I need a root canal. Go.
Yeah. So I'm an average dentist. I would say, well, if you want to keep your tooth, Allison, the only way to do that is we have to do what's called a root canal, where we go in and basically do like a roto-rooter through these infected canals, and then we seal it up with either gutta percha, which is a sap from trees, or something else, and you're good to go. No pain.
Okay, that sounds great. Sign me up. So why did I run into you then at a conference, the Wise Tradition Conference for Weston Price Foundation, and you're giving a speech called Root Canals, the Deadly Truth, which I really liked how you spelled truth, Trooth.
Thanks.
What's so bad? I mean, you just gave me the best pitch ever for why I should have a root canal. I don't see anything wrong with it.
Yeah. Well, that statement that you just read by the AAE, it's misleading, because they actually say the words that we can sterilize your tooth and get all the infection out, and that's where where it's not true. So just to keep it real simple, each tooth has approximately 1 to 3 miles, human miles, of dental tubules. So that's where all the communication, all the blood flow, all the nerve feelings, everything happens inside of a tooth. It's the life force. And you can't clean 3 miles of tubules with anything. I mean, I brought up that they are working on a really amazing way to do a biologic root canal, which involves ozone water, ozone gas, and a certain kind of laser. And we can certainly get, much cleaner and get a lot more of the bugs and their toxins killed. But bottom line, Allison, is that you can't get it 100% clean. So you're always going to have a low-grade infection there. And that's the issue.
Okay. So what then is the danger about it? I mean, what I heard you just say is kind of like, it's not a great fix, but maybe another dentist would say, it's all we got. It's like the only option. It's your best case scenario. Like otherwise you could have this, really, really bad. And that's often how modern medicine sells procedures to people. Right. Kind of like often how we get sold presidents these days too. Sometimes it's just like, look, it's the lesser of the evils. Just go for it. What do you think about that? I mean, what are the real risks to getting it?
Well, again, if you're so is there anything else in our bodies where we would leave an infection? So if we had an arm that was getting gangrenous, we would cut it off. If we had an organ that was beyond repair, like gallbladders and things like that, people have them removed, which I disagree with. But my point is that if you have infection, you know where it is, you can locate it, and you can get rid of it. That's the game plan. That's what you do. That's the goal. Now, being Weston Price, people, we obviously look at things like our diet and ways to prevent even getting into this state. And of course, I highly recommend that if we can have a great diet, we have good home care, and we can do whatever we can to avoid getting sick and having a tooth get so decayed that it needs a root canal. That's the ultimate goal. But let's say that we're already there. You can't leave an infection. So in a healthy person, say that you're healthy, you've got no autoimmune issues, you got no history of cancer, you're young. Yeah, you can probably tolerate a root canal. A lot of people do. There's a lot of people walking around with them right now saying, what's he talking about? I've got 2 or 3, I'm fine. For now, your body is walling off that infection and it's keeping it at bay and maybe localized in the head. But that's not the way it's going to be forever. And for a lot of people, just getting one root canal takes them over the edge.
Okay. This is my quick commercial break. One of the products I totally love, this actually a Weston Price Wise Tradition sponsor, is Green Pasture. If you go to greenpasture.org, you can buy one of my favorite products ever. Greenpasture.org, use promo code Allison at checkout, Allison with 1 L. This is what my family takes. My dad, orthopedic surgeon, got us into this many years ago. Fermented cod liver oil and concentrated butter oil blend. Great for your teeth, great for your immune system, great for your brain. Actually, I have a question for Dr. Cole coming up in a second about this stuff because it was very controversial for one particular dentist who commented on my YouTube video. So I'm going to ask you about all that. But anyway,
Okay.
This is what we do, the cinnamon tingle flavor. Okay. But they've got lots of great products. And my dad, actually, this is how he got into learning about how food and nutrition can really change medicine, because his dentist was telling him he needed a root canal. And he discovered through the process that he was vitamin D deficient. That totally changed the way he's practiced medicine. And he actually was able to avoid getting root canals. So greenpasture.org, use promo code Allison at checkout for 10% off. Let me show you that comment. Okay, this is the video I did with, let's see, this is the Green Pasture video. I just stopped in at the Weston Price. See them right here.
Okay.
There's Carl the Codfish and Addie and everybody. And I was just telling everybody about how they're such a great sponsor. Love the family it is. Okay. So Dave here says, I'm a dentist with 20 years of experience who's seen just about everything to do with teeth. You cannot heal your cavities and teeth that need root canal with cod liver oil. You only need to have the most basic knowledge of tooth anatomy and physiology to know this is wrong. At best, this will give a placebo effect. Encouraging people to take this product over proven dental therapy is wrong on many levels and potentially dangerous. People have died from untreated dental infections. Allison, I challenge you to put those reporter skills to use and look into this, because your endorsement of this product could really hurt people. Okay, so I'm not actually asking you to necessarily opine about the cod liver butter oil, though you can if you want to.
Yeah.
But I think the point Dave's trying to get across here is that, like, you can't just nutrition your way out of a root canal. You can't heal yourself. You know, these are proven dental therapies, and it's dangerous to push this idea that you should look for alternative ways to deal with it.
Well, you two are talking about, believe it or not, 2 different things. There is a point of no return. So Dave is talking about, you've already got infection into your pulp. He's right. Once you get infection in the pulp, you got to do one of 2 things. You either do a root canal or you pull the tooth. He's absolutely right in that regard. But you're correct in that you're talking about, if I get cavities, but I'm not into the pulp yet, because the pulp is fairly deep, 5 millimeters, 4 to 5 millimeters deep in the tooth. Can you not reverse this? You're absolutely correct, as was Weston Price, as is many people who know about nutrition with cod liver oil and just a good diet, a good alkaline diet. You can absolutely arrest decay and sometimes even reverse it. So you're both right. You just got to know what that point of no return is.
Okay, so like in the case of my dad, where his dentist told him you should get a root canal, and then he goes into this journey where he finds out about Weston Price, and then he's changes the way he eats processed foods and takes the cod liver butter oil and all that stuff. Do you think in his particular case, then, like, he didn't maybe even need the root canal and the dentist was wrong? He didn't really have an infection that had begun in his tooth.
Yeah. I think he had a cavity, and I think he probably had a deep one, and it was probably very close to the pulp. And what year was this, Allison?
Oh man, probably 15, 17 years ago.
Okay. So we didn't even have cone beam x-rays. We didn't have the 3D CBCT x-rays. So your dentist was looking at, a very small just a 2-dimensional image of it, and probably saw a very deep cavity and said, this is so close to your pulp, it's probably already in there. You got to get a root canal. And that's what a lot of dentists say. So I do believe that it was not into the pulp yet. Yep.
Okay, so what is the best way then for someone to get to the bottom of their particular individual case of dental treatment if you're not even sure your dentist is like up to speed on what's really going on here? So you're like, I guess, when do you know, hey, I need to take emergency action, or maybe I could change my diet and try to have more vitamin D. Like, what are the questions that someone should ask their dentist to make sure that they're really getting all the information about their particular case?
Well, you're going to have to find a really good dentist, first of all. And of course, since I was a biologic dentist my whole career, I highly recommend that you at least find a biologic dentist. And if, by definition, just to make it simple, that's a dentist who works like a functional medicine doctor, looks at everything, has discussions like you and I are having right now, ask detailed questions about your diet history, your health history, your family history, takes x-rays, good, nice clean x-rays with a cone beam, a 3-dimensional cone beam. You have to have that, because if you're looking at either teeth that possibly need root canals or old wisdom extraction sites, or God forbid you have root canals that are failing, the only way you can truly diagnose that is on those 3D CBCT cone beam x-rays.
If you want to send me some real mail, please. Someone hand painted me
That's awesome.
wine glasses. How amazing is that? So thank you to Marty. That was Marty of Lake Panasoffkee, Florida. Thank you, Marty. I got the wine glasses. You can send me mail. Nothing creepy, nothing edible, unless we want to arrange a half cow or something like that. But don't send it to my P.O. box, because it will just sit there and rot. P.O. Box 3355, Denellen, Florida 34432. Thanks, everybody who has sent mail. You can also support me at Locals, AllisonMorrow.locals.com, where you can be on my editorial board. That's where you get to ask questions ahead of time for interviews. One question that I just thought of. Okay, I know people who have had like chronic staph infections, for instance, and have had doctors like yourself who have the kind of mindset you do say, look, you have a terrible diet, you don't get enough sunshine,
Right.
and you're stressed out, and that's why you're getting infections. So why couldn't somebody push back on the whole, like, you don't have any hope other than pulling your tooth or getting a root canal if you have an infection, when it seems like infections can be a result of the fact that you're just deficient in a lot of different things, and maybe you're just very stressed out, and you couldn't take maybe some time to try to address that? I mean, was your head going to explode? I mean, what's the worst case scenario? Get septic, or
Well, that's
and please, I mean, push back on me. Is that not the case? Like that,
no,
you
I'm not
that way.
I would say that's how you won your argument against that one dentist. I mean, you're absolutely right. Listen, let's use the word infection correctly, because infection, we're talking about root canal infections and all that, which is obvious infections. But even a cavity, that is an infection. So a small little cavity in a tooth, it's an infection. It's a local infection, one that you can clean out, or as you say, for lack of a better term, find God and start eating better and exercising and getting sunlight and, getting oxygen. I mean, sweating. I mean, these are all things that detox the body and make us healthier. So yeah, I'm a strong believer that somebody can totally turn around their oral condition if it's bad. And I don't care if their mouth is acid, which it shouldn't be. It should be alkaline. But if a mouth, I mean, listen, I had patients for 30 years that came in, they were sick as dog. They had everything. They had all these autoimmune conditions. And we started with what you just mentioned. The first thing I'd say is, tell me about your diet. Let me hear about your diet. And I don't want to hear a perfect day. Sometimes I would say, here, go do a 3 to 5 day actual diet log for me and include the weekend, because things are different. And it was amazing the things I would see. And listen, people don't always know. People don't know that if you go to a grocery store, the entire, the 90% of the store is garbage except for the 2 outside aisles. If you go to a regular store, right? I mean, fresh organic produce on one, and then over here we've got some, things in the fridge, and that's about it. The rest are, processed. And so, but maybe people don't know that. And so we don't want to judge them. Let's just say, start learning more and reading more, like the Weston Price Foundation, and learning about food and how we can cure ourselves more naturally.
Yeah, I mean, honestly, it's like my election day mantra, because I often, like, every time we get to one of these days where, like, watching our figureheads, debate, and we're putting all our hope on them. We forget that we're making all kinds of little choices throughout our days that have a real serious effect on our actual lives.
Yeah.
And, we just wait for like one day every 4 years or something to think about this. And like you said, I mean, one great way to start would be just like learning how to read ingredients on labels, just start there, like learn what those ingredients are, or, find the person near you who is, raising pastured chickens or eggs, organic eggs or whatever.
Yes.
Like
Yes.
these are all great ways to dive in, that do not require you to like write angry Facebook posts about, grandma or whoever else. So I encourage people to do that.